In this video, we will be discussing fasciola. The genus Fasciola has got two species. Those are Fasciola gigantica and Fasciola hepatica. The common name for the Fasciola species are the liver fluke. That is nothing but the flukes are migrate in the liver, so thereby the name came as liver flukes. And this disease is also called as fluke cirrhosis, liver rot, fascioliasis, fasciolosis, and clay pipe cirrhosis, pipe stem liver, and gallstone formation. When it comes to the location of the fasciola, bile duct is the site for the mature flukes, whereas the liver parenchyma is the site for immature flukes. These are the pictures of the fasciola gigantica. Here you can notice these things. And the intermediate host is snail. And the very important snail is Limnia acuminata. At least you have to remember the at least one name of the snail, that is Limnia acuminata. Now, look at the differentiation between the fasciola hepatica and the fasciola gigantica. As the name itself suggests, gigantica, which is larger in size comparatively hepatica, and which has a leaf-shaped body and have indistinct shoulder. In fasciola gigantica, the ventral sucker is larger than the oral sucker, and the intestinal ceca is branched and it is diverticulated both externally and internally. But in case of fasciola hepatica, it is only diverticulated only externally. And the test is placed in the middle region in fasciola gigantica, whereas in fasciola hepatica, the testes are placed at the posterior region. And in case of fasciola hepatica, the oral sucker and ventral sucker are of same size, but in case of fasciola gigantica, ventral sucker is a bit larger than the oral sucker. And fasciola hepatica has a prominent shoulder, but in case of gigantica, which has indistinct shoulder. This is the fasciola hepatica, which is characterized by leaf shape having distinct shoulders, and the intestinal ceca branched and which is diverticulated only externally. Now let us look at the characteristics of the egg of the fasciola, which is composite egg and which is oval in shape with yellowish tint with indistinct operculum. And we need to differentiate this egg with the parampistoma, where the egg is transparent with distinct operculum. But in case of fasciola, the egg is indistinct operculum with yellowish tint. Now let us look at the life cycle of the fasciola. The life cycle is divided into two types, that is based on the uh, now let us look at the life cycle of the fascioliasis. The definite host for the fasciola is ruminants, and whereas the intermediate host is snail, and that intermediate snail is an invertebrate. So they are saying that development in the invertebrate host, what will be happening in the snail. And before entering into the snail, the eggs were passed in the feces via cattle, buffalo, sheep, and goat, and those unembryonated eggs will become embryonated, and they will hatch as the miracidium under the influence of adequate temperature in the environment, and that miracidium will actively penetrate the snail, and after the penetration of the miracidium into the snail, then the developmental stage such as the sporocyst, radia, and the cercaria are being present in the snail body. And after the cercaria will be formed in the snail, and that will come out as a metacercaria, and which is insisted as the metacercaria. And the one more important point in this life cycle is that the cercaria is of gymnocephalus, and this is very important with respect to the examinations, where in case of fasciola we got the cercaria is gymnocephalus. And after from cercaria to development into metacercaria, and this metacercaria is an infective stage of the fasciola that will enter the definitive host and cause the disease. And the metacercaria will enter the cattle, buffalo, and any other ruminants via eating up herbaceous postures, or sometimes drinking up contaminated water, and which are having metacercaria. And this is about what happens inside the intermediate host. And after entering of metacercaria, into the vertebrate host, that is nothing but the definite host in the cattle and buffalo, and the metacercaria will exist, that will be occurring in the duodenum. And after the existation of the metacercaria, the immature trematode that will uh, penetrate the duodenum, thereby it will enter the abdominal and the peritoneal cavity. And inside the peritoneal cavity there are organs, and this immature fluke has got more affinity towards the liver, and sometimes it will enter the bloodstream, and sometimes it will reach the heart also. But in majority of the times the immature flukes has got affinity for the liver, so it will penetrate the liver capsule, and it will start migrating inside the liver parenchyma, thereby it will start destroying the parenchyma of the liver and leading to hemorrhages inside the liver. And after the migration inside the liver, and that will reach again, it will reach to the bile duct, where it attain its sexual maturity, and inside the bile duct it will pass, start laying the eggs, and those eggs will be passed in the feces. And this whole life cycle will be completed, it will take around 70 to 17 to 18 weeks, and this is about the life cycle. Now let us look at the pathogenesis. This is very important aspect of the disease, where one can divide the pathogenesis as the acute fascioliasis and the chronic fascioliasis. And in case of acute, acute is due to the immature flukes, because the damage due to immature flukes is very huge, so the disease is occur suddenly. And in this acute fascioliasis, which is characterized by traumatic hepatitis, hepatitis is nothing but the inflammation of the liver because of the trauma created by the migration of the flukes in the parenchyma of the liver. So this is termed as the traumatic hepatitis, where there is extensive destruction of the liver parenchyma along with the hemorrhages will be there. And whenever the postmortem will be doing, and during that time the liver will be enlarged with a pale in color. The pale in color is because of the loss of blood, so which leads to the pale anemic with sometimes there will be hemorrhagic tracts on the liver surface. And one more complication of the acute fasciolitis is that the cattle, buffaloes which are suffering from the acute fasciola, and they are more susceptible to the black disease. Black disease is a disease which is caused by the bacteria Clostridium novae. The thing is that whenever the immature flukes will penetrate the liver, and because of the deep penetration, the bacteria has got affinity towards the anaerobic condition, because the deep penetration, and in that area the quantity or the amount of air present during the deeper inside the tissue is less, so thereby that will provide a good or the adequate condition for the development of the anaerobic bacteria, that is Clostridium novae, which results in the black disease. Now here you can look at the acute fasciolitis, which is characterized by the flukes containing in the liver parenchyma, and sometimes not even the liver, but also sometimes lungs and heart also affected. Now let us look at the chronic fasciolitis, where it is due to adult flukes, and uh, the adult flukes are present in the bile duct, so obviously the pathological lesions will be noticed in the bile duct. And sometime in the normal sequelae of the chronic fasciolitis is the hepatic fibrosis. Whenever the acute stage will be passing and leading coming up chronic stage, that stage is manifested by the fibrosis. So the common sequelae for the chronic fasciolitis is the hepatic fibrosis, and in the chronic fasciolitis nothing but the which is caused by the adult flukes, which is characterized by the presence of adult flukes are in the liver of the bile duct. And that condition may result in the hyperplastic cholangitis in the liver and bile duct, which is due to the presence of the adult flukes. And in such cases the bile duct will the wall of the bile duct will be get thickened, and so thereby it gives the appearance of a pipe stem liver, and resulting in a condition called clay pipe cirrhosis or the pipe stem liver. This is the fibrosis of the lung tissue, where one can notice the chronic fasciolitis. Now let us look at the clinical signs. And normally whenever the disease is there inside the body, and the animal will show the conditions like anorexia or weakened and emaciated, and this disease is noticed in all the age group of the animals. And the important significant clinical signs such as the appearance of edema, especially at the regions of submandibular regions, that is referred as the bottle jaw or jaw edema. It is because of the loss of proteins, that is nothing but the hypoalbuminemia, that is nothing but the loss of absorption of the proteins. This may be the one of the reason, or sometimes because the liver is damaged, so the production of protein, the efficiency of production of protein by the liver also got affected. So because of that condition, and also coupled with the loss of absorption of proteins, so the destruction of duodenum is there, so some amount of absorption of the proteins from that area will be affected, so ultimately leading to the loss of proteins from the body, resulting into the bottle jaw condition. And in some cases, especially the acute fasciolitis, has shown the diarrhea followed by the constipation signs. And the disease can be diagnosed by just looking at the clinical symptoms like anorexia, emaciated, weakened, bottle edema, and this along with this the fecal sample where one can notice the fasciola egg, which can be diagnosed very easily just by looking at the egg, which is oval shaped, yellow tint, and which has got indistinct operculum. And sometime the weather forecasting has also helped in the diagnosis of the disease, because during in the March and the December time the disease has occurred more frequently, and sometimes one can use the immunological tests also to diagnose this disease. And ultimately when it comes to treatment, triclabendazole at the rate of 10 mg per kg body weight can be used as the drug of choice. And one can use the fluicides, and uh, one can use the molluscicide where they can kill the intermediate host. And the animals should be reared on the snail free pastures. And this is about the control aspect and the treatment. In next video we will look at one more other trematode. Thank you.